Shear, and I work on the Community Programs and Engagement team here at the Livestrong Foundation. And I just want to take a moment to welcome you all to our home and to thank you for coming for this really informative and great session that you're going to hear this evening. First, I wanted to just say a thank you to Sarah Gomez-Waters for organizing the session today. So we're happy that you're able to do this. Thank you, Sarah. And then it's my pleasure to introduce our speaker for the evening. So please join me in welcoming Elizabeth Colvin. She directs the Ensure Central Texas program for Foundations Communities. Prior to launching Ensure Central Texas in 2013, she created and ran free tax preparation programs both here in Austin and also in Houston. And she's consulted with free tax programs nationally as well. Elizabeth has a background in labor and employment law, and she has spent her career advocating on behalf of low-income communities. Welcome, Elizabeth. Thanks for being here. I don't know how much we're going to have the mic, but we'll turn the volume up.
Yeah, do I need the microphone? Yes, okay, great, I'm happy to use it. Well, I'm excited to be here tonight. Thank you for this opportunity to talk about the Affordable Care Act. The open enrollment season, the second open enrollment season is upon us. It starts November 15th, and we have less than half the time that we did last year to enroll even more people. So it's only 3 months, November 15th through February 15th, and it's of course over the holidays, so it's going to be an exciting open enrollment season. And I'm glad to have this opportunity really to educate people and prepare people, because there are so many misconceptions still about the Affordable Care Act. And it's important that people get the facts, because how it impacts you and the price you have to pay is really different for everyone. So we try and tell people, don't rely on what your brother said, or what your neighbor said, or what your coworker said. You really need to get the facts for yourself. So, the Affordable Care Act really brought transformative changes in healthcare. People can no longer be excluded for pre-existing conditions. Insurance companies can no longer pick and choose who they want to sell insurance to. For the first time, women are not charged more than men for insurance, because apparently being born a woman was a pre-existing condition. So insurance companies historically always charged us more. And you can now get free preventive services. There are some catches to that, and we really try and educate our customers on, be very clear when you go to the doctor and ask for the free preventive services, and tell them, if you're going to do something that I would be charged for, let me know before you do so I can make an educated decision about whether or not I want that service. There are no lifetime caps or annual limits, which were tremendously burdensome on people and caused a lot of fear anytime you had a medical crisis. And now dependent children can be covered up to age 26 on their parents' plans. In reality, that works better if your parents have coverage through an employer. If you are working, supporting yourself, and not a dependent on your parents' tax return, it's actually better if you just apply directly through the marketplace and get your own plan yourself. So, the reforms that make insurance easier to get. Insurance companies now have to sell insurance to most anyone. They can't pick and choose. And how insurance is priced is no longer some mysterious actuarial formula based on your entire medical history. Insurance plans are based on age, where you live, household size, and whether or not you use tobacco. Which is great, because we can figure out exactly how each plan is priced, but that means each plan is really different for everyone. Because if someone's 5 years older than you, their price is going to be different than yours. If your household size is different, your price is going to be different than theirs. So when someone asks me, so how much is my plan going to cost? It's not something you can know off the top of your head. You really have to go on the marketplace, do the calculation to figure out their pricing. That's why you can't rely on what other people tell you. You have to get the facts for yourself. If you ever applied for insurance before the Affordable Care Act, it was one of the most intrusive applications you could fill out. You had to disclose anything, everything that had ever happened to you related to your health. And now, the application is more like applying for a bank loan or a mortgage on your house. There are no questions about your medical history at all. The questions are all about your income, your tax filing status, because it is now tied to the tax code. And the only question that relates anything to your health is whether or not you use tobacco. And that's the only question related to your health or any of your behaviors. Also now, through the marketplace, when you're buying a plan, you know that any plan you purchase will have these 10 essential benefits. Prior to the Affordable Care Act, and actually even now, because plans have been grandfathered in, you can get a plan that may not include hospital coverage, which, I mean, I'm not sure what value does that have when really being hospitalized is the most expensive thing that can happen to you. But there are those still some, I would refer to them as bad plans because they don't cover what you think insurance covers. They're still out there because they're grandfathered. But if you're purchasing through the marketplace, which is healthcare.gov, you know that those plans have these 10 essential coverage areas that you would expect an insurance plan to have. Prescriptions, maternity, hospitalization, rehabilitation, things you expect to be covered are covered. However, the plans cover these things differently. So with rehabilitation services, one plan might allow for 20 visits and another plan might allow for 40 visits. If that is important to you, you need to look at each plan and see how that is treated when you're making your plan decisions. This is where there's a lot of confusion. So who benefits the most from these reforms under the Affordable Care Act? The Affordable Care Act was really designed to provide health insurance to people who couldn't access it through other means. So people who don't have access to insurance through their employer, who are not eligible for CHIP or Medicaid for their kids, or who are not eligible for Medicare. So if you have access to insurance through those other means, you are not really going to benefit from the financial subsidies under the Affordable Care Act that are designed to make insurance affordable for people who can't access it otherwise. And if you have any questions, please just raise your hand, stop me, I'm happy to answer any questions you have. Or if anything I say you're confused about or don't understand, please stop me and ask. Yes?
Is there a difference between the marketplace at health.gov than going straight to Blue Cross Blue Shield?
Yes. The difference is to qualify for the subsidies, you have to purchase it through healthcare.gov.
But the plans are going to be the same, everything else is going to be the same.
Actually, no, because the network may be different. The network inside the marketplace may be different from the network that you get through an employer or outside the marketplace. So there are some differences, but you're only going to qualify for the subsidies if you purchase a plan through the marketplace. So there are two subsidy programs. There's the premium tax credits, and that's designed to reduce the cost of your monthly premium. And the range of individuals who can benefit from that basically are less than 400% of the federal poverty level. But the premium isn't your only cost. That just helps you get health insurance. The other reform or subsidy that helps you are the cost sharing reductions or cost sharing subsidies. And those reduce your costs when you actually use your insurance. Because you can have an insurance card, you can have a low premium, but if you have to go to the doctor, you're going to have co-pays and co-insurance and a deductible. And the cost sharing reductions are what reduce those amounts that make it feasible for you to actually use your insurance. And those benefit people between 100 and 250% of the federal poverty level, but you have to purchase a silver plan. With the premium tax credits, you can purchase any metal level, the bronze, silver, gold, or platinum. For the cost sharing reductions, you have to pick a silver plan. So this is a picture of coverage in Texas, and it's a bit odd. When the Affordable Care Act was originally passed, it was designed to provide coverage from everyone from 0% of the federal poverty level up to 400% if you did not have access to insurance through your employer. And it was a comprehensive picture. And not everyone is eligible for Medicaid, so they made exceptions for those people who have lawful status in the United States but can't get Medicaid because of their immigration status. So they extended subsidies to those below 100%. Yes?
Are these slides available to us?
Yeah, Sarah will make them available. So the law passed in 2010, and it was this comprehensive picture. It went to the Supreme Court in 2012. The Supreme Court ruled the Affordable Care Act was constitutional, except for this one piece. They said you couldn't require states to expand Medicaid. They made that optional. So we live in the great state of Texas, and the state of Texas has decided to not expand Medicaid. So it's created this unusual picture where people from 100% of the federal poverty level and up are eligible for subsidies if they are not eligible for insurance through some other source, but people who earn less than 100% of the federal poverty level are not eligible for subsidies. So that is what we call the Medicaid Gap. So our amazing volunteers have the challenge of telling people that you really make too little to qualify for the subsidies that make insurance affordable for you. And that's what we call the Medicaid Gap. Dollar figures to the chart you just saw. So for a single individual, 100% of the federal poverty level is $11,670. So that's sort of the threshold of income that people have to make. And you can see from 100% to 250, it's a broad range. And even going up to 400% is a very broad range of income that people who can benefit from the subsidies under the Affordable Care Act. But remember, and I keep repeating myself, you're not eligible for these subsidies if you have access to insurance through your employer or other means. So I'd like to put this picture together for you. This is Adam, and I've changed his name and a few details to protect his personal information. But he's a customer who came to see us at Highland Mall. He's 28 years old, and let's say he has an estimated income of $17,000. He works for a restaurant that does not provide insurance, and actually he had a pre-existing condition and was not eligible to purchase insurance otherwise. So when he came to us, he was uninsured and uninsurable. For a 28-year-old living in Travis County, the cheapest silver plan last year, we don't have the numbers yet for this year, for 2015, was $175. And remember, that price is going to be different if you're 29 or 27. It's different for every age. But for a 28-year-old, it was $175. For someone who makes an income of $17,000, he was eligible for a premium tax credit of $157. And there's a formula that we know exactly how that is calculated. So 175 minus 157 leaves a premium of $18 that Adam was responsible for paying. So the way this works is Treasury sends $157 to the insurance company each month. Adam sends his $18 to the insurance company each month, and the insurance company ends up with $175 every month to cover the cost of the monthly premium. But these calculations are based on an estimate, Adam's estimated income for the next year. When he files his taxes after the end of that year, the premium tax credit is recalculated based on his actual income. So if he overestimated his income, say he makes less than $17,000, he's actually going to get some more premium tax credit back on his tax return. But if he underestimated his income, say he actually made $20,000, he would have gotten more premium tax credit than he was eligible for, and he's going to have to pay some of that back on his tax return. So it's all reconciled on the tax return. Yes?
What if you get divorced in the middle of the year? You just make the best estimate of income between the two spouses, and then the next year you figure out if you're under or over?
Well, that is called a life change. So when you get divorced, you need to update your application to reflect that information. And if you lose your insurance due to a divorce, that's a life change. You need to update your application, or you may qualify at that point for insurance.
You can do that outside of the enrollment period?
Yes, yes. And you're actually required, if you have a life change like that, or if you get married, have a baby, lose your job, that will qualify you for a special enrollment period. So that will allow you to enroll outside the open enrollment. But getting sick, having a car accident, getting some sort of diagnosis, those are not events that qualify you for open enrollment. I mean, for outside open enrollment, for a special enrollment period. You have to get enrolled during the open enrollment period for insurance.
So let's assume that a spouse was under another spouse's employer plan or didn't go through the system and then ends up in a divorce and now has a low income. Can he or she start as if they're in an open enrollment?
Yes, because that qualifies them for a special enrollment period. And when they file taxes, your tax filing status is based on your marital status on December 31st, the last day of the year. So they would file as single, or depending on whether or not they had children, it maybe head of household. And it would be based on whatever income they're going to claim on that tax return on December 31st. But for that special enrollment period, they could do an application then, qualify for insurance, qualify for subsidies, and they would base it on how they're going to file their taxes for that year. Yes?
Talk to me about moving from one county to another when you're covered.
If you move from one rating area to another, that's a qualifying event that you could, because the pricing is going to be different, the networks are going to be different. So at that point, that's a qualifying event for a special enrollment period.
You get to start over.
Yes, when you move, yes. All right, yes, sir.
So there's a minimum income of around $11,000. What are people that make less than that? What do they do?
I will get to that. I will cover that.
Okay, I'll wait.
All right, so let's talk about the cost sharing reductions. And to me, this is really one of the more exciting parts of the Affordable Care Act because it allows people to actually use their insurance. And am I making it hard for you, Sarah? Okay. Keep moving. So that $175 plan without any cost sharing has a very high deductible and out-of-pocket maximum. A deductible of $4,600, out-of-pocket maximum of $6,300. So if that's the insurance Adam had, he doesn't really have much incentive to use it because he's going to have to pay a lot out of pocket before he feels like he has insurance. But because of his income level, he's between 100 and 150% of the federal poverty level. He gets the maximum cost-sharing reductions. So there are 3 different levels. For if you're 201 to 250% of the federal poverty level, you qualify for 73% cost sharing as opposed to just the straight out 70. So for those folks, it's sort of like getting a Silver Plus plan. It makes a little difference, but not a lot. Where it really makes a difference if you're below 200% or below the federal poverty level. You get 87% cost sharing. So that's essentially like a Gold Plus plan for the price of silver. Or for Adam, he was eligible for 94% cost sharing. So he's getting better than a platinum plan for the cost of silver. So his deductible was just $500 and his out-of-pocket maximum was just $750. So, I mean, that's what, you feel like you can use your insurance with these amounts. So, Adam came to see us. I was at Highland Mall, and Adam came in late July. And he was very concerned about his insurance being canceled. And he wanted to make sure his insurance could not be canceled without his knowledge. And we assured him that as long as he paid his monthly premium, his insurance would not be canceled. And then he whips out his phone and shows us this picture. In May, Adam had been skateboarding. And as he told me, skateboarding is very dangerous. He fell and broke his femur, and this is his femur. His friends took him to the emergency room, thankfully the one that was in his network, and he ended up having some days in the hospital, surgery. He had a rod and 3 pins installed. That cost $55,000 for his surgery, his hospital, and all of the work that he had to have done because of that accident. But thanks to the fact that he had insurance, and it was all done in network, his out-of-pocket maximum, his liability was $750. He has to continue paying his premium. But you can see how transformative this is for someone, and how if he had not had insurance, how financially devastating it is.
I have a question.
Yes.
I'm confused. It seems like the lowest income, which is the 250% of federal poverty level, is paying the most out of pocket.
No,
Okay,
it's
I'm
actually
reading it
more
wrong.
than-
Yeah. No, 0%. You're making $0.
Oh.
Then it's 100 is the lowest amount. That's 11,000.
Oh, I see.
And then it works up. Yes.
Yeah, I was looking at it ass backwards.
All right. So here's another story, and this really answers your question. So the Affordable Care Act is unique in the fact that your deductible, your premiums, and your cost sharing reduction is based on an estimate of what you're going to make next year, which is very different from CHIP, Medicaid, or other benefits programs that take a snapshot of where you are now, or where you were the past 6 months, or where you were the past month. The Affordable Care Act looks forward. So right for this open enrollment period, we will be asking people, what is your estimated income for 2015? That's very challenging because none of us have a crystal ball. And for some people whose income fluctuates a lot, it's challenging for our volunteers because somebody's like, I don't know what I'm going to make next week, much less what I'm going to make next year. But you just have to figure out some way, and we give our volunteers tools to do this, to come up with an estimate based on the best information that we have. Yes?
Is income limited to salary and wages?
No, it's actually MAGI, which is Modified Adjusted Gross Income. So it includes your non-taxable and your taxable Social Security. It also includes SSDI, which is not on the tax return. It does not include SSI. So there's certain things that it includes and does not include. But it includes pension, things on the 1040 that you would expect to see on the 1040.
Dividends
Right. Yes. Yeah. Yeah. But the exception is you add in that non-taxable Social Security and SSDI that doesn't show on the tax return, which is really helpful to people being able to include that. You include that as part of their modified adjusted gross income. So let me tell you this story. So this is another customer who came to see us at Highland Mall, and I'll call her Edna. So she's a single mom with 3 children. She works at a restaurant that does not offer health insurance. Getting health insurance was very important to her. She had not been to the doctor for many years, other than just for the birth of her children, and she wanted to make sure that she had insurance, so if something happened to her, she would be able to take care of herself so that she could take care of her children. But when she came to us, based on what she was making at that time, her estimated income for the year would have been underneath 100% of the federal poverty level. But because it's looking forward, she went and got a part-time job, working 10 extra hours a week, making tamales. So that income, is looking forward for the year, would boost her above 100%. So the advantage here is that people have some control over their application because they're looking forward. So we'll talk to someone who's right around 100% of the federal poverty level and ask, could you get a seasonal job? Could you get a job over the holidays that would help boost your income above 100%? For people who are self-employed, it may be, could you take on an additional client and get that additional money each month or each week to boost your income? Especially people who are really close, and we're talking $1,000 to $2,000 is going to get them above, and they have the ability to work a little bit more to get those dollars. Or for people who babysit, look after kids, it's like, well, charge your neighbor some, claim that on your tax return, and that will boost your income for the coming year. So we tell our volunteers we want to empower people with their choices and their options, because this health insurance is a really rich benefit and very important to people. And now I realize not everyone can do that. Some people are working as hard as they can. They absolutely can't do anything more. But for the people who can, they do have some ability to get above 100%. Yes?
One of my brothers works as a call center director of Minnesota Care. He tells me stories about people who are making
I mean, that's not something we see at our centers. The people we see are earning less than 200% of the federal poverty level for the most part, or and qualifying for subsidies. And I mean, I think in every benefits field, you have people who are gaming the system. But this is really about helping people understand what the rules are so that they have the ability to make some decisions that are going to benefit their family and themselves. Yes? Yeah, so it's what you're pulling out of that retirement that you pay taxes on when you pull it out. Yes, yes, because it's going on your 1040. Right.
What about what you don't pay taxes on, like you pull them out of the law?
Yeah, if you're pulling it out of a Roth and you're not paying taxes on it, that's one of those things. That's one of those answers I should know, but I want to check myself before I give you an answer. Because I'm thinking through the Magi chart in my head. Yeah, and it's not there for Magi, even though you do include like non-taxable Social Security, so and you include non-taxable foreign income. You do include some other things, but I want to check myself before I give you an answer.
So what for Ednas? What was going to happen if she didn't make that extra?
So if she didn't, she said, I can't work anymore, she would have been in the Medicaid Gap. If she lived in Travis County, she would have had the ability possibly to sign up for MAP, the Medical Access Program. But if she's not in Travis County, there are really limited options for people in the counties outside of here, because the Wilco card, which is in Williamson County, only benefits people at up to 25% of the federal poverty level. So it's very limited assistance.
So you said she would have Medicaid or she wouldn't?
No, she would not get Medicaid. I mean, the reality is in Texas, a teeny sliver of the population gets Medicaid. So the people who are falling in the Medicaid gap, it's a gap because they can't get Medicaid. Yes?
I just wanted to you're saying that they have these visitor programs, and you do, like we'll go to Hayes, Burnett County, they have a max cap of $30. So after that, that's all they pay. $30.
Right. I mean, the Wilco plan benefits very few people. So the rural counties are really, the people living there are at a disadvantage. The MAP program looks incredibly rich compared to the others.
Yeah.
Now, if you fall into the Medicaid gap, you will not be penalized on your tax return for not having insurance. So we tell people, I've got good news and bad news. You know, the good news is you're not going to be hit with a penalty. The bad news is you're not eligible for affordable health insurance. So let's talk about plan selection, because on the marketplace in Travis County this past enrollment season, you had 80 choices, and it's overwhelming. You think from a behavioral economics standpoint, that's a nightmare to have that many choices. So we really work with our volunteers to assist people on this plan selection to figure out what plan will work for them. And so we ask people these questions, and anyone going through this process needs to really put some time into plan selection to make sure that you pick a plan that's going to meet your needs. So we ask these questions, and you have the information sheet that we use as an information tool in front of you. That's the colored sheet, and on the back of that, those are the questions that our volunteers will go through someone for plan selection. And then the other handout that I gave shows you just a sample of the range of plans that people can choose from. So we tell people you've got a lot of choices, and then we figure out based on their priorities which plan to pick. And if someone's eligible for the cost sharing reductions, you remember you have to get that silver plan to benefit from those. This is a summary of benefits. For anyone picking a plan, it's really important that you look at the summary of benefits. And insurance companies are required to provide this for every plan on the marketplace. And by hitting details when you go on healthcare.gov, you will get the summary of benefits for every plan. And it's the same. So you can do a sort of apples to apples comparison of the plans you narrow it down to make a decision. So it's very important to look at this information, especially for anyone on a long list of prescriptions. You need to make sure the prescriptions you are on are covered. For your doctors, if it's very important to you to see certain doctors, You need to call those doctors and make sure they are in network. And you need to be specific when you ask that question. Don't say, do you take Blue Cross Blue Shield? You need to say the full name of the marketplace plan. Do you take Blue Cross Blue Shield Blue Choice PPO? Or do you take the Humana HMOX plan? And we've learned this because people have just called and said, do you take Aetna or Blue Cross Blue Shield? And gotten misinformation because they said yes, but they may not take this particular plan that they're buying in the marketplace. So it's really important you ask the right question. And we had a lot of challenges this first enrollment season where we would call a provider's office and they say, we don't take any Obamacare. Well, do you take Blue Cross Blue Shield Blue Choice PPO? And they would say yes. So everyone's been on a very steep learning curve and really didn't understand that Obamacare is private insurance. Humana, Aetna, Cigna, Blue Cross Blue Shield. And they're often accepting some of those plans. But you have to make sure you talk to the right person to get the right information. So this is our enrollment center at Highland Mall. We're open there 7 days a week. It will be November 15th through February 15th, and then any extension. We're open 7 days a week. You don't need an appointment. Just walk in. We have 4 other locations that we are available and ready to serve you. We operate on a retail model because we want to be as convenient as possible for the public. So like when you need to go to the grocery store to buy milk, you don't have to think, is this the day they sell milk? Do I need an appointment for the milk? You just go. And that's how we want our service to be. You don't need an appointment. You can just go to Highland Mall. We're open 7 days a week and we are there. Our volunteers are there, trained, happy to serve you. So in the first enrollment season, we had 15,000 come through our 5 enrollment centers. And our volunteers enrolled 10.8% of those in Travis County who enrolled in marketplace plans.
How many is that?
That was 5,647 individuals in qualified health plans. Yes?
Where are your other locations?
We are in South Austin at Stastny and Westgate. We are at LifeWorks on Pleasant Valley, not far from here, near 7th Street. We are at the Round Rock Public Library on Main Street. And we have a new location this year at the Southeast Health and Wellness Center in the old VA clinic, if you've been in Austin a long time, at Wooltorf and Montopolis. Yes?
So, assuming you're enrolled in a plan and you do nothing, do they automatically enroll you?
Re-enroll you?
Switch plans, you need to notify the prior plan not to get re-enrolled?
So are you talking about re-enrollment for the next year?
Yes.
Yes. So if on the application, on those last questions, you gave permission to the marketplace to look at your IRS information, there was a question about that. If you said yes to that, they're going to check that information, base your premium tax credits on your last tax return, and automatically re-enroll you in the plan that you're enrolled in. We are trying to educate people. You need to come in and take the step of actively updating your income on your application for people, because we serve people whose income changes a lot, so that last tax return may be way off. So you need to update your information, or maybe you got married, divorced, household change, something like that. Update your application. And it's always good to shop around, right? Because we think prices are going to change. So take advantage of the chance to see, you may want to change plans, or at least look and see what your options are. You may decide, I love my plan, I want to stay in it, but at least make sure you update your application so your income reflects what you're going to make next year. Yes?
If someone's going to come to one of these locations, what do they need to be prepared to bring in with them if they're walking on a walking basis?
On a walking basis. So we actually tell people you can walk in without anything. Some people aren't ready to commit, they just want to ask questions, and that is fine. If they just want to come, get educated, ask questions, we are happy to do that. If they're ready to enroll, they need to bring the Social Security numbers, date of birth for everyone on their tax return. It's helpful if they just bring their last tax return, but if you didn't file taxes last year, that won't impact your eligibility for next year, because remember, we're always looking forward. If they have an offer of coverage through an employer, they need to bring that information, because they likely will not be eligible for subsidies, but we can evaluate that. If they are not a U.S. citizen, they need to bring their immigration documents, their LPR card, their employment authorization card, their naturalization certificate, because we have to upload that to the system to basically prove that they are who they say they are. Yes, sir, you had a question?
Well, you addressed it a little bit when you talked about the non-U.S. citizen. I was wondering if they did not have a Social Security card, what other forms of documentation or anything that they might need?
There are two groups that are not eligible to purchase insurance through the marketplace. They're undocumented, so someone who does not have a Social Security card and is not eligible for a Social Security card is not eligible to purchase insurance through the marketplace. The other group are people who are incarcerated and are not pending disposition of their charges. But in Texas, we have a lot of mixed status families. So just the fact that someone in your family is undocumented, maybe your spouse or your parents are undocumented, that does not disqualify the household. So you actually do the application. So we had parents come in, both undocumented, wanted to purchase insurance for their children because they made too much to qualify for CHIP or Medicaid, and you can do that. You absolutely can do that. You do the application in the name of the parents, but you just say they're not purchasing insurance. You're only purchasing insurance for the people who are eligible, which would be the kids who have socials and are U.S. citizens.
What if the children don't have Social Security cards?
So if everyone in the household is undocumented?
Children just don't have Social Security cards because they were born here, but they never filed for it.
Pretty much everybody who's born here gets a Social Security card at the hospital. They would have to go to Social Security and get a Social Security number. I mean, they're going to need that for their taxes. Pretty much everything else, they're going to need to get that number. So just like filing their taxes, they're going to need to get that Social Security number. Yes, sir.
A couple of questions. One, the very first slide you had up there says, I wanted to make sure on this, it said that they cannot price because of pre-existing conditions.
Yes,
Is that correct?
That is correct.
And the second question is, are there HSA type plans available through the market?
I think that's a separate determination whether it qualifies for HSA. I'm not aware of any that were in our market, but I think you'd have to there's a separate determination on how much the deductible is and how the plan works, whether it be HSA qualified. The other thing that's important to know about Insure Central Texas is that we're open year-round. We don't operate our retail model year-round because we pretty much lose our volunteers at the end of the enrollment season. But afterwards, by appointment, we will see people. So we've had 1,200 appointments since the end of the open enrollment where we've assisted people with issues with insurance, with special enrollment periods, with questions about how their insurance works. You name it, the whole range, we've seen people throughout the summer. And Insure Central Texas is a program of foundation communities. We are a nonprofit that's been around for 25 years, and our core business is affordable housing. We own, I can't keep track because we are growing so fast, but we own about 15 multifamily properties in Austin that provide really high quality apartment homes to lower income families. The reason why we're doing health insurance is that we also do free tax preparation, financial coaching, money management. We do savings programs for individuals. We want families to achieve financial stability. But you can be the best budgeter, you can save. If you do not have health insurance, all of that is gone in an instant with any sort of medical crisis. So families can't have financial stability without that health insurance. And before the Affordable Care Act, there's nothing you could do. I mean, if your employer didn't provide it and you had a pre-existing condition, you really didn't have any options. But this Affordable Care Act has provided people with the option to get insurance now to give people the peace of mind and financial stability that they need. Any questions? Yes, sir.
I don't know if you find it in your centers, but there are small businesses that have employees and they set up a shop program. And it seems to me one of the advantages of that is that they can enroll people as they change. In other words, they bring somebody in June that person would be eligible to get coverage through that SHOP program. Do y'all deal with those people or mainly individuals?
Our focus is on individuals because SHOP really requires a whole different level of expertise, and our focus is on helping the individuals.
I understand.
To expand Medicaid, is
There is a group called Cover Texas Now that's a coalition of various groups that is working on the expansion of Medicaid. And I think they have a website called Texas Left Me Out that you can look at where they're collecting stories around Medicaid expansion.
Is the chart for the estimated household income, is that for Texas only? Or is each state, does each state have a?
Yeah, no, actually the federal poverty level applies to every state. So those numbers are fixed whether you live in New York City or Utah, Texas. Yeah, that chart is the same.
What is the federal government?
Well, that's what the chart is on the information sheet that you were handed at the bottom. It changes every year. So that's where for a single person household, it's $11,670. Yes.
Another question. I have not been to the marketplace recently, but let's say you've got 4 insurance companies that offer coverage in Texas. And these rates that you have on the sheet, those premiums, are those going to be consistent with all of those companies?
Yeah, okay, let me explain my sheet I handed out here, because I don't want anybody to leave with a misconception. Remember I said it's different for everybody's age, household size, and your income? So this snapshot doesn't apply to anybody in this room. This applies to just the person that we entered their information for. So do not look at these prices and make any assumptions on them. So, because the pricing is going to be different for each individual. But you can see here that this person, under silver, it says 87. So that means they're qualifying for cost sharing reduction. So we know that it's between 151 and 250% of the federal poverty level is what this person's income was. But we don't know what their age is. So this is their range of options. And those prices are set for the year. So the premiums, I'm not sure if this answers your question, the premium will not change in 2015. Like once you enroll, that's your premium for the whole year, and your deductible is set, your out-of-pocket maximum is set, that won't change.
Well, my question was the same individual, and they're looking at 4 different companies. Are the premiums going to differ between the companies?
Absolutely, yes. And you can see the huge range. So here, there are 30 silver plans. The cheapest silver plan costs $72.76 a month for this particular person. The most expensive costs $187, and there are a total of 30 options in between those 2 numbers. So yes, there's a huge range on the pricing. Now generally, the HMOs are what you're finding at those lower levels. The HMOs are considerably less expensive than the PPOs. So that's why on this sheet you may notice that the platinum plan is less expensive than some of the gold plans. That's because there was just one platinum plan last year, and that was an HMO. So that was actually less expensive than some of the gold PPO plans. Yeah.
So pretty much you need to see whether it's a PPO or an HMO to know what you have. And they could be in any one of these categories.
Yeah, so you have the platinum is the only one where you just have one choice and it was an HMO. But all the others you have a choice of HMOs or PPOs.
And the catastrophic is still available?
The catastrophic is actually only available if you're under age 30. So this person was obviously under age 30. And there's some other exceptions where you qualify for a catastrophic plan, but the premium tax credits do not apply to the catastrophic plan.
So you might have mentioned it, but my son works at Whole Foods, single, is he supposed to go for the employer's insurance? Is that better?
Yeah, so if he is offered insurance from his employer, he will not be eligible for subsidies on the marketplace because he has an offer. Yes, right, because he has that option. Now technically you can shop around, he could compare prices, but you're not going to get any discount here. These are full price expensive health insurance plans. And the other thing to keep in mind is that when you get insurance from your employer, that's pre-tax. When you're buying it here on the marketplace, that's after tax. So it's not really an apples to apples comparison looking at the prices. So if you have an offer from your employer, that's in 90% of the cases, that will be better. The exception that we see is for hotel employees, for the cleaning staff at a hotel, like a high-end national chain. They offer insurance to their employees, but that insurance can be incredibly costly for the lowest wage employee. So if the insurance your employer offers you is more than 9.5% of your household income, which happens for some of these hotel employees, at that point, that's deemed unaffordable, and so those employees are eligible to purchase insurance through the marketplace. Yes, sir.
The situation, I own a corporation. I'm the sole person that works for the corporation, but my corporation pays for my individual medical plan, my individual insurance plan. It also pays my HSA contribution. Am I still eligible for the marketplace?
That is a more complicated question than I am used to getting. I do not know. I think you have to, whoever your CPA is should be able to answer that question for you.
Back to the question, you said specifically hotel employees. So that means if someone who works for, say, a certain store.
That was just an example. That was just.
It'll work for any.
It'll work for anybody whose insurance.
Health insurance at their place of business, their premium ends up being more than
9.5% of their household income. Their household income, not their income, their household income.
So is that gross?
It is their magi, yes. So it's their, yes. But we don't see it that often. That's the only place I've seen it. The other thing, if your employer offers insurance that does not meet minimum value standards, which we also see, that's deemed inadequate. So that qualifies you to purchase insurance on the marketplace. So there are these exceptions. That's why we tell people you need to get the facts for your unique situation. Bring your employer's coverage in if you think it's too expensive or inadequate, and we can tell you. Yes?
What if it's a new employee and there was like a 90-day waiting period? Can they be on the marketplace until their effective date?
Yeah, yes, but there's a delay in getting insurance through the marketplace, just like there is through an employer. So you can't sign up on the marketplace and have insurance the next day. Yeah, it depends when you sign. If you sign up before the 15th, it'll be effective on the next month. If you sign up after the 15th, it's a whole other month. So some of the examples of inadequate plans that we've seen is preventive-only services, which cover no medications, no hospitalization, nothing really. It only helps you if you're well. So a plan like that, that's not real insurance, you can, if that's what your employer offers, you can get insurance through the marketplace. AFLAC, which some employers offer, that's not, real health insurance, you qualify for subsidies on the marketplace. Indemnity plans that only pay $100 a day if you're in the hospital, something like that, that doesn't exclude you from going to the marketplace. Similarly, COBRA, if you're offered COBRA, you have the option of going to the marketplace. Insurance, your retirement, as a retiree, you actually have the option during open enrollment, not outside of open enrollment, going to the marketplace. So there are lots of exceptions. It's a complicated law. It's administered through the tax code. So you really need to get the facts for your unique situation.
And you said it takes more than 30 days to get on the program?
No, it depends when you sign up, very much like other things. So you have to sign up before the 15th of the month, or by the 15th of the month for it to start the 1st of the next month. If you sign up after the 15th, then it's a whole nother month delay.
If you signed up November 16th, it would be
start
January,
December 1st.
December, it would affect December.
Right, but that's if you were eligible for special enrollment. So for people, for this open enrollment period, you need to sign up by December 15th for your insurance to start January 1st. So that's what we're signing up for in open enrollment, for insurance to start either by December 15th for January 1st, or if you sign up after that, it's sort of this rolling start date. Yes?
I assume that your COBRA coming to
Yes, yes, that would qualify you for a special enrollment period.
The other question is, the Highland location is one of the ones that's open year-round?
Yes, our Highland location is open year-round, and our south location on Stastny and Westgate is open year-round. Yeah. Okay.
If you inherited money, is that considered income? You have to.
I'm trying to think how that would show, because I think the state pays taxes on that. Yeah. It doesn't show up on your tax return. Unless it's invested and you're paying money on the dividends, and that's where it would show up on your tax return.
That was excellent.
Yes, thank you very much.
Okay. All right, thank you.